So the next question, should a previously root canal treated tooth be removed and substituted with individual teeth, implant, or a bridge? And then it's kind of a two-part question. And the second part is it advisable to use braces or aligners for teeth alignment in this case? So for part one, is it recommended for a root canal treated tooth to be removed and substituted?
So the first part of the question is, should a previously root canal tooth be removed and replaced with a bridge or an implant? The gold standard of care nowadays is anytime a tooth is removed, whether it is a root canal treated tooth or a broken tooth or like a really big cavity tooth, anytime a tooth is removed, except for the wisdom teeth, we always recommend that tooth to be replaced with a dental implant, which is the gold standard of care. Of course, can that tooth be replaced with the bridge? We do not recommend replacing a tooth with a dental bridge, because anytime you need to do a bridge, what that means is if you have a missing tooth on this side, you have a tooth on this side and you have a tooth on this side, and then you have a missing spot, then you have to grind the two teeth on either side to be able to connect them like a bridge. So we do not normally recommend that. We even call that this is kind of a barbaric treatment which we used to do several years ago, which is even still done some of the times, but the gold standard of treatment is without touching the two teeth on either side. Put a dental implant right in the middle, just like you guys see right here in this model. So when you have two teeth, so you have an implant here or an implant here, and then you can have actually this is not the best demonstration. Actually, this is the best demonstration right here. I don't know whether you guys can see it clearly. So a bridge, you have to cut the tooth on the front, cut the tooth in the front, and to put a 3-unit bridge. Whereas for an implant, all you have to do is to put an implant just like this in the front. So you don't have to touch the tooth on this side, touch the tooth on the other side, and you can put an implant right in the middle where you have a missing tooth spot, and you can replace the tooth with an implant. So that is the part one of the question. So my recommendation would be to highly consider doing an implant. And the second part of the question is it advisable to use braces or aligners for teeth alignment in this case? I'm assuming the follower is concerned about some kind of a tooth movement because of either the missing tooth or possibly the root canal tooth is being damaged. So the ideal way to do this is, after you remove the tooth, do the aligners or do braces to adjust the teeth or move the teeth properly to the proper alignment of the teeth. Then after the teeth come into the proper spot, put an implant to replace the missing tooth.
Great. So I'm going to just kind of recap and summarize. So yes, replacing with a single implant is better than doing a bridge, is what I'm hearing you say. And then secondly, before you do any kind of braces, ortho, whether it's the clear braces or whether it's the traditional, you recommend doing that prior to placing the implant so that the room is created that you need for that implant and that crown to be. Correct?
Absolutely correct. And then just to add one more thing, and I'm glad you mentioned that, the reason it is critical is we always say that, implants, they look, function, and feel like a natural tooth. But unlike a natural tooth, the implant cannot move. So once you put that implant in there, that is going to be there solid, just like a rock. It's just going to be rock solid there. So you cannot move an implant. So the braces can only move the tooth. They cannot move the implant. That's why it is critical that you get the braces prior to putting in the dental implants.
Awesome. Thank you so much.